Hi, my name is Alexis. I'm going to be showing you how to do a catheter for a female. To start off, I've already checked the patient's records. I've double checked the order to make sure that the physician put it in. And so now we're going into the patient's room. Oh, before I did, as I'm walking into the patient's rooms, I'm doing hand hygiene. Knock, knock, knock. Hi, Mrs. Jones. I'm Alexis. I'm going to be a student nurse today. We're going to be putting in a catheter for you. Can I see your ID band? Thank you. And then do you have any allergies to iodine or latex? No? Okay. So before we even start, I'm going to raise the bed up a little bit. And I'm going to put the side rail down. Alright, and then first we're going to do some peri-care. So I'm going to take your blanket down. And before I start, I'm going to close the curtain. And I have adequate lighting to have my area. So I'm lifting up your legs. I'm going to put gloves on. And I'm going to put down a waterproof pad underneath you. And then we're going to put the bath blanket over you. So I'm going to take my cloth with my warm soapy water. I'm going to dip it in the water. And I'm going to wipe up from top to bottom. Then I'm going to rinse, rotate my rag, and do the other side. So rinse, rotate again. I'm going to wipe down the middle. And then I'm going to dry the area as well. So now that that is done, I'm going to remove my gloves. And perform hand hygiene. And now we're going to set up my field for the sterile catheter. So I'm going to make sure that I open it with the top away from me first, making sure only to touch the outer corners. And I'm going to put on my sterile gloves. Okay, now I'm going to set up my field. I'm going to put the shiny side down. I'm going to put this one underneath Mrs. Jones. And I don't need to use this one, so I can dispose of that. And then with this, the bigger one, with the shiny side down, I'm just going to put in between Mrs. Jones's legs to expand my sterile field. And now I'm going to set up my tray. So Mrs. Jones is not allergic to iodine, so I don't need my hydrogen peroxide. But I'm going to open this and put it over my cotton balls. And then I'm going to take my lubricating jelly and put that on my tray as well. And now I'm going to grab my catheter and pull that out, making sure it doesn't fly anywhere, and dispose of this. And I'm going to set it in the jelly about 1 to 2 inches. And then I'm going to as well take the cap off the syringe and hook that up so I can have that ready. So now I'm going to take my cotton balls with my dominant hand, pick it up, and then with my non-dominant hand, I'm going to use my thumb and forefinger to have the labias open. I'm just going to down and dispose. Another one, other side, down and dispose. And then one more, right down the middle and dispose. So now we are ready for the catheter. Going to pick it up, bring it closer to my sterile field, making sure not to touch anything else. And I'm going to hold it about 1 to 2 inches, and with my non-dominant hand holding the labias open, I'm going to slowly insert it, making sure that there is no resistance, and if there is, just slightly twisting, do not shove it in. Okay, so now that it is in all the way, I'm going to take my syringe and inflate the balloon. And then I'm going to remove the syringe and discard of that. So now I am going to clean. Before I clean it, I'm going to pull on the catheter to make sure that it is in there, not pull on it, but just a tug to make sure it's in there. And now I'm going to clean the area. So I'm going to take a rag, dip it in some clean water, and just wipe around, making sure to get off the excess lubricant and iodine. And now I can remove my glove. Well, I'm going to clean up and take my bag and hook it to the side of the bed. And I'm going to tape the catheter to the side of Mrs. Jones' legs, making sure she still has some slack so she can move around. And then after that, I'm going to remove my gloves, throw those away, perform hand hygiene. And now we're going to make sure all this is put away. And we are going to get rid of this pad, and we are going to put Mrs. Jones into a more comfortable position. So Mrs. Jones, I'm going to lower your legs, cover you up. I will raise the side rail and lower the bed until the lowest position. And then I will make sure that Mrs. Jones's call light is near her, and on my way out I will perform hand hygiene again.